Welcome to Forum 360. I am Mark Welfley, and thank you for joining us with our Global Outlook with a Local View. Do you believe that one website can change the world forever? This website will compel us to face questions that will be debated for years, if not decades to come, like how important is learning, and should we have essential knowledge in our head, or is it enough to have it only at our fingertips? The website I'm referring to is openai.com and its product ChatGPT, an artificial intelligence program that can process incredible amounts of data and not just give a transactional answer, but write research papers and pass the CPA and the bar in one day. And according to a Journal of American Medical Association article, a chatbot's responses to patients' questions pulled from a social media platform were rated significantly higher for both quality and empathy than a human doctor. So what do we make of all this? Today we examine the convergence of social media and artificial intelligence on the profession of medicine with Dr. Eve Crane, Medical Director of Hematology at Cleveland Clinic. Dr. Crane has written an article in the AMA Journal of Ethics spotlighting the use of social media in medicine. We will also get her thoughts on artificial intelligence in medicine. Welcome, Dr. Crane.
Thank you so much for having me here.
So tell us a little bit about your background, how you became both a doctor and interested in hematology and then social media.
Okay, that's a pretty long question. Let's see. I became interested in medicine as a young child. My father had multiple sclerosis. I don't usually like to talk about this. It's really hard to talk about, but that was back in the 1980s when he was diagnosed, and there were essentially no treatments at that time, and even to diagnose it was pretty challenging. And I got into medicine at that point, kind of thinking about kind of what are the differential that it could be, what are the possible therapies it could be if you went down one avenue or another, and ultimately narrowed down to multiple sclerosis, for which there was quite a broad range of ways that it could go. Some people have a very indolent course, some people have a more aggressive course, and all these things were unknown. And I thought, well, as a kid, this is terrible. People really want to know what they're facing. They want to have better treatments. We want to have more hope. And I thought, well, I got to do medicine because that's what I want to do. I want to figure this out. I shouldn't have started talking about this. It's very difficult for me. But that's what started it. My older brother is a MD PhD as well. Also interested. He does a lot of neuro-otology sort of work, also very interested in that kind of field. And so that's what got us both started. And to think, not only do I want to practice medicine, I want to be on the research side, I want to be on the education side, interest in kind of biomarkers to better understand what the mechanisms of disease are. And it's sort of a very long course through that to kind of find my way ultimately to my current position. But with background in chemical engineering and then ultimately doing an MD PhD program to get that research background that I really wanted. My research for my PhD was in the peripheral nervous system. And it was quite interesting. My boss for my PhD, my mentor, he had his background in hematopoietic stem cell biology. And so he had done a lot of the very pivotal work in flow cytometry, which is kind of looking at each individual cell one by one, looking at what that cell does, the potential of that cell, and sorting it by flow cytometry. And so he thought, well, now we kind of want to apply that to the nervous system, which also may have stem cells that you could also sort and study and look at individual cell properties. And so I got very interested in flow cytometry, applying all of these things from what we knew about blood and bone marrow to the nervous system, and particularly working on peripheral nervous system diseases, although multiple sclerosis is, of course, a disease of the central nervous system. But the peripheral nervous system has more regenerative capacity in stem cells, and so this fit very well with kind of my interests. Going on from there, I got a brief a few blips along the way. For a brief period of time, I decided I should potentially just be a surgeon. And so I did a surgical residency for 3 years, which was amazing. But then I realized, my true calling was in pathology, where we're looking more at the diagnostic standpoint, mechanisms of disease, and have time to think a little bit more deeply about the underlying mechanism of the disease processes. And so that fit very well just with my overall goals and with sort of my passions. And then the aspect of getting into the blood rather than the nervous system, because basically what I do now is focusing entirely on diseases of blood, bone marrow, and lymph nodes, kind of all these circulating cells, is applying some of that knowledge that I had kind of going back to the flow cytometry I was doing on the nervous system, but returning now to the hematopoietic system, where we just is just at a point where there's a lot of very exciting stuff we can do because of the tools that we have and kind of the detailed knowledge that we have of single cells and the potential of the stem cells and different things. And so that's how I ended up doing pathology and sorry, there's a small bug near me. And ultimately, I came to the Cleveland Clinic, where just a lot of opportunities, certainly with the large group that we have and the broad number of specimens that we see, and just and the research capabilities there, that just really thought this would be a good place for me to really blossom my interests.
Glad to have you here.
So,
talk to me a little bit about social media. Like, when did social media enter your mind, and where you would need to kind of embrace how you were going to use it in your practice of research?
Yeah, so social media was something that came to me when I was a fellow, when I was doing my fellowship in hematopathology at Johns Hopkins, that a couple of my co-residents were interested in it. Actually, one of my co-residents was doing this whole series for the AMA Journal of Ethics. Like, she was invited to be a guest editor, essentially, because of her interest in that, and she had I believe she had a background in that as well, coming from her undergrad and then a prior graduate degree. And so we had began talking about this because it was an area that I thought was my background sort of more of a scientist rather than as the social media. But I realized that with pathology, we're just kind of isolated, and you want to tell people about your ideas. You want to collaborate with these ideas. Maybe you discovered something and you're excited about it. It's hard to know how to reach the other people who might see this, especially for rare diseases and things like that. And so it kind of, through these discussions, kind of through the things that were happening at Johns Hopkins at that time, we began to realize, we can put some of this information kind of onto social media. We can, reach others who are studying these rare diseases all over the world. Potentially you could reach patients and have their input as well. But it was, how do you do that in a way that's safe has been something that was a question, and what sort of material do you actually put up there? So that was kind of how I got into it. But yeah, I think one of my more senior mentors, who is a gastrointestinal pathologist, would actually put, and gastrointestinal pathology is very common. I guess, imagine pretty much everybody should get a colonoscopy. So there's all kinds of material that we're getting, and so it tends to be a bit more de-identified. If some, an unusual colon polyp, well, that could have come from anyone. So that was a little bit more amenable to safely posting on, say, social media.
Because the names of the scans
aren't the scans, and the diseases are very common, and everyone's kind of getting these things, and no one's associated with it, and so it could just be kind of interesting findings from just the tissue.
Sure.
But kind of observing that and the discussions that people would have and kind of the teaching format that it would create, a lot of people could learn from this material. It was very accessible. You can put very high quality images on there that so it's not like someone has to be sitting next to you anymore at the microscope to be able to learn, because that's kind of how we usually did it in pathology. But now everyone can learn worldwide from this, and then go back and take it to their practice, kind of unusual things and interesting things.
So are there a couple of rules that you came away with in your working through your social media? Don't identify the names, only put scans of common diseases? I mean, are there kind of rules of the road that you follow? Is it still being defined, or how?
It's still being defined. So that was kind of the thing.
it?
So this was in 2016 when I started doing posts, and we kind of had, like, we had a strong sense of what we felt should be the rules. Like, certainly the material had to be de-identified, but it also had to be de-identified to the extent that you wouldn't be able to identify it. Like, maybe, for example, if you were to publish something in a journal, you don't know exactly when that person may have come into the hospital and things like that. But if you say, like, oh, look at this thing, look at this gunshot wound from this thing from the ER today, it's like, well, okay, now you turn on the news, you know exactly who that is, even if you didn't say. So we tried to start making a list, but we realized there really weren't any defined things, and there were people who were posting things that were, somewhat inappropriate. And so at that point was when we decided to work together with the Journal of Ethics and things like that to say, okay, now what exactly, can we start defining a set of rules to do this safely? Because it became clear that we're going to be shut down, like, if we didn't do it properly. Like, if it's, that we would lose this opportunity to communicate and teach through this very powerful mechanism, if there weren't safeguards in place. And because it's so easy to just sign up for an account, obviously, you can have, trainees or other people that they're, not meaning any harm necessarily, but maybe just get particularly excited about something that they see. And so, so then we have defined kind of specific rules, which we put into that. The paper's getting a little bit older now, certainly, but I think that those rules have stood the test of time and have been used now across medicine as well by other fields to help, provide guidelines for that.
So there's, I think, in my simple mind, there's two ways social media is kind of involved in medicine. One is doctors, researchers speaking to doctors and researchers, and I think you've kind of plumbed that out and kind of defined there's rules, and they're loosely structured, but they're holding tight and de-identifying stuff. But there's the other part about doctors, researchers, and actual patients using social media to communicate with patients. Where does social media, or where do you stand on where the rules are there?
Yeah, no, I think that's a really interesting area, because as a patient, you have very little contact with the pathologist. Typically, you may, people now have MyChart and things like that where they can actually read the pathology report. But before that, often it would just be, maybe an oncologist, maybe primary care, or your surgeon who would say, okay, this is what we found here. This is what the diagnosis is. And typically, people like to, have it be something solid. This is colonic adenocarcinoma. Okay, people know what that is. But increasingly, we're kind of realizing, particularly in the field that I'm in, with kind of altered immune status, like a lot of people are on drugs that alter the immune system and things like that, that you may get abnormal proliferations that are not just, cut and dry. And so you're getting more complex kind of reports coming out that, patients may need to actually speak with their pathologist about, because it's not necessarily leading to, you got disease X, you need therapy Y. It's like, what exactly does this mean? And so it creates a way for patients to understand a little bit more about the process if they want to, and potentially connect with pathologists to discuss. And another area is certainly with biomarkers. Like, there's a tremendous number of, for example, with breast cancer or other things, like different testing that you could send out everywhere. Like, get, different, maybe an RNA profile of what genes are being expressed by this thing, maybe a mutational profile, maybe chromosomal aberrations. And so we're like, what testing do I want? Where do I send it? Where should I get a second opinion? So, like, these things kind of open up the possibility that pathologists could, or other physicians could potentially interact with patients. But obviously it's a little bit of a double-edged sword, because you don't know who's going to read it, how it's going to be interpreted. Some of these things are short communications, shouldn't really be used for medical advice, but it does create the opportunity, at least, to create that interaction.
Interesting, thank you. If you're just joining us, thank you. I'm glad to have you with us. I am speaking with Dr. Eve Crane, and Dr. Crane is the medical director of manual hematology at the Cleveland Clinic. We've been talking about social media and its intersection with medicine, and then came artificial intelligence.
Yeah.
Yeah. And so I want to know, you are a medical professor and teach. And so if a student came to you with a research paper on biomarkers that was created by ChatGPT and you read it, like, where do you stand on where you go from there?
I mean, I'd probably read it and think, wow, this is amazing. This is the best written article I've seen. Like, I've been impressed with ChatGPT. I think it's just, you can type in questions and it very rapidly generates all kinds of things, pulling all kinds of different data. So, and it's written, you know, in a way that's fairly easy to read, and it's pretty interesting what it can do. So I think, you know, the possibility that I have received material, particularly, you know, I act as an editor for multiple journals, that some of this material has been generated by ChatGPT is probably high. And informal kind of surveys that have been done of pathologists suggest they are using it for that purpose. You know, for example, writing an introduction to a research paper and things like that. I think there certainly could be a role for it, but obviously it has to be, you know, very carefully edited, you know, maybe even just sometimes having an initial draft, like sometimes you'll have a resident write an initial draft and then you substantially alter it from there, but sometimes even having a draft to begin with could be useful. But yeah, I think it's definitely going to alter the playing field. And I have seen it used, I mean, we have a lot of continuing medical education sort of applications. I recently wrote a book with two other colleagues on biopsy interpretation of the bone marrow, and it does come with a lot of online material that you can use to kind of learn and kind of use with the book to kind of quiz yourself. And so generating all of those questions and generating appropriate distractors and kind of having a place to start, or kind of maybe doing something different than the questions that you've been asking for years. It's like, what can I do that'd be different, or how can I, like, you can actually use ChatGPT for that. And my colleague, who's very senior in the field, his son actually works for Google, like, he actually tested it out. I don't know if he actually submitted any of those questions in the end, but yeah, he was very impressed with the sort of things that you could actually use it for, in a way that's positive.
So am I hearing you say, not trying to pin you down, but maybe just to further the conversation, that if you don't have that knowledge in your head, it's okay, as long as you have it at your fingertips and give proper attribution, or in the medical field, specifically with maybe non-research doctors, but just doctors, do they need to have what ChatGPT, what they would normally have in their head, that ChatGPT shows them? Is learning still valuable?
Learning is absolutely still valuable, and I'm really glad you brought this up, because I think, you know, as a pathologist, we're dealing with a tremendous amount of information. I mean, we have, and it's constantly growing every day in terms of what we know about tumors, what are the prognostic markers, what are all these things, and what is kind of the differential when you're thinking about something. Like, you've got to do the right testing to get to that right diagnosis. So you've got to have a very broad base knowledge to know what you're doing. But at the same time, you can't know everything at once. So we're constantly on the internet, constantly looking in books. But ChatGPT has the, I mean, potentially, I mean, or some of these things that are doing you know, a constant search of what's out there, have that ability of, you know, helping to synthesize additional new information that you may not be aware of. Obviously, you still need to go through the traditional means and still have that background. Without the background, you won't even know if that stuff is correct. You won't even know how to fix it. So it could be a complete nightmare for people who are not, you know, trained in the area, and they don't know what, you know, because not everything in there is accurate. And sometimes you want to find papers that it fabricates, you know, publications that don't even exist, but they sound like publications that exist, and things like that. So there's a lot of things that are still going on in there that if you don't use it very carefully or use it in the appropriate manner, you know, but it's still evolving. I think
Sure.
a lot of us are still trying to get a grip on it.
So if a scan came to your office in front of your computer and was read by ChatGPT or interpreted and said, okay, this person has X condition, would you know it was ChatGPT, or would you research it, or like?
Well, it's actually really
do you take
interesting
things on face value, or?
Well, yeah, I mean, we never do that. But I think, what you say is really interesting, because this has been a huge area of interest in pathology. Somewhere you have like radiology, where we have all the, the images are all scanned in now. We're doing that more and more with our glass slides, that are slides of a piece of tissue that are scanned in. And one of the things we look for, kind of micrometastasis or something like that, with like a breast cancer, like is this lymph node? That's not what I personally do, because I'm looking at more of the nodal pathology itself. But looking for small pathologies in there, sometimes something that's automated could potentially do that better or as good as a human. And there's other things that may do better. Like there's certain patterns that I look for as a pathologist, but there may be other aspects that that are just kind of beyond what I look at. That when you use machine learning and you say, here's a whole bunch of things, here's a whole bunch of scans that all did this, and it can find other patterns that you're not appreciating with your eye. So I think that that's going to be extremely powerful. Like, yes, well, I hope I don't get just eliminated. That's possible, because it's like there could be that a robot's going to be better at this, and then I'll be like, you're like, oh, this is a funny interview back when, but back when we had pathologists. You talked about at the beginning of the interview of becoming a researcher and a surgeon. 40 years training to do this or whatever, and now it's like,
10 minutes, but
I think right now it's certainly, as an adjunct, is extremely powerful. Like, make sure things aren't missed, kind of as a quality control, novel ways of identifying, because a lot of things are pretty hard to diagnose. We have a lot of ancillary testing that goes into it. Maybe we could streamline that and say, hey, you know what, into the algorithm, it looks like it fits into this pattern. You want to order a stain for some sort of viral association or something like this. So I think it's a very fascinating area in pathology, and particularly pathology as opposed to other areas of medicine. We get a tremendous amount of data, like all of the blood tests that are being done on patients. All of that data is going into our data sets. All this flow cytometry, like I mentioned, like single cell data. Sometimes on a single cell we may get 14, 18 parameters on that cell. Well, you can't even look at that properly, so a lot of artificial intelligence is going into the further analysis of that, and of these tissue slides is a whole other thing too. That's really kind of at its infancy, but it's one of the the hottest topics at all of our meetings, to kind of figure out if there's a better way than just basically staring in the microscope of identifying what's going on with an individual patient.
So in the couple of minutes that we have left, I want you to put your future looking glasses on, and I want you to take me 10 years into the future, and I want you to tell me what's going to be at the intersection of medicine, social media, and AI in 10 years. Like, what's your life, your job going to look like?
Oh, that's a pretty tough question. I mean, I think that in terms of the diagnostic standpoint, we're going to have a lot more artificial intelligence that's going to go in even upfront to the diagnostic standpoint, and that may be analyzing all of the data from an individual patient's chart, as well as that tissue diagnosis, and coming together and being, hey, look, he's on this particular pattern of medications, this is the pattern we see, worry about X, and so I think patients are going to get a lot more information that maybe kind of lack of privacy and things like that, but it may actually be much more informative from a health standpoint. In terms of social media, I do hope that there will be also more of an integration there, that it will be a forum that positively creates information and connects people, which is what it has been thus far for me. Like, in terms of, it connects me with people that I would have never met otherwise, including, people in other countries with unusual diagnoses or things like that. They do reach out to me. Sometimes they'll even send me scanned reports, scanned slides, that I can, interpret with some caution, or, advise them on who to seek out within their home country of how to do that. So I think a greater, kind of interaction between patients and physicians across the world and trainees too, because a lot of this material used to be kind of held by different societies, would have like a meeting, you have to go, you have to pay to see the material. It's like now the material is just open sourced, and most of us are just happy to share that material with anyone who wants to be educated and that kind of thing. So or has a comment about it, or maybe things are it just opens a whole dialogue.
Sure.
So I think it's going to be exciting. If I'm replaced by a robot, I don't know, maybe I'm not sure what I'll do, but I'll try to find something to do.
I think we're all going to be replaced by robots.
Yeah.
My daughter and I were talking on the way down about, in social media, you may give up a little bit of your privacy in the case of medicine for a better outcome, and are you willing to take and give up that privacy for the better health outcome? If, say, your scan had to be sent to India for reading, do you want your brain scan over there? But so we had a conversation about that. It was nice having.
The patients definitely. Some of them do actually, sign a waiver and say, I want my case to be presented on social media or in a case report, but never should it be shared if it's something unusual without that consent. For sure. Yeah.
As the medical profession, is it better or worse with the emergence of social media and artificial intelligence? Is the world better or worse with social media and AI? I guess we'll see. I wonder if Albert Einstein predicted the emergence of artificial intelligence with his quote, "I don't need to know everything. I just need to know where to find it when I need it." I would like to thank Dr. Eve Crane for being here today. Thank you.
Thank you.
And encourage each of you to keep your minds open. Until next time on Forum 360.
Forum 360 is brought to you by John S. and James L. Knight Foundation, the Akron Community Foundation, Hudson Community Television, the Rubber City Radio Group, Shaw Jewish Community Center of Akron, Blue Green, Electric Impulse Communications, and Forum 360 supporters.